Hi guys, this is Dr. Chaffin from the SI Institute in Phoenix. Tip of the day, okay guys, is focus on your hygienist and your hygiene department. Especially if you're getting into implants. But what if you're not? Either or, but in an implant practice, it is so important to have a hygiene program. So here at the Institute, we not only just teach you implants, but we also go through restorations, we go through a periodontal program. All right, so I'm gonna give you kind of a glimpse. Tip of the day is to take a look at your periodontal program and to make sure it's operating as top of line as it possibly can. Hygiene is the artery of any general practice, and it's something that I always like to bring attention to kind of help the general dentist. All right, I have a chart back here, all right? Periodontal evaluation, everybody does one in the practice. But there's two kind of practices that I see in my consulting experience throughout the country when I look at practices. Have you ever seen a practice that does prophies? And when you look at their hygienist, every single patient is a prophy. 55, getting a prophy. 62, getting a prophy. Everybody in the practice is a prophy. That's a prophy palace. And that's not utilizing effectively your hygiene department. Those are usually restorative driven practices, but I see it all the time. Then you have perio maintenance practices, where the diagnosis is being done, they're probably getting some therapies, and then they're shut back on a perio maintenance, and you never for 10 years see that client ever taken off there again. Now, while they're doing the diagnosis correctly, once a perio maintenance patient, it is pretty much unlikely that for 20 years they're never taken off for more therapies, okay? So we're gonna go through a little bit of a thing that you guys can utilize. If you need a copy of this, just call the Institute, we can shoot a copy out for you. But periodontal disease is dictated by not pockets. I know, I'm gonna get a lot of flack for this. It's actually bone loss and attachment loss. And it's something like in dentrix, it's called the CAL number, clinical attachment loss. Take a look. So in this evaluation form, if you have no attachment loss, now what is attachment loss? It is from the CEJ is where the bone should be. And if the bone has dropped, you have exposed roots, which is clinical attachment loss, okay? Bleeding is not a dictating factor of periodontal disease. That's the dictating factor of do you need treatment or not. So if you have no attachment loss, then you probably have localized infection, you can get a prophy. Let's say you're kind of caked up, so you have generalized moderate severe inflammation, do some scaling, then reevaluate the patient, and then put them on a 6-month recall. Okay, pretty much. I don't see this as being done a lot in a practice. They'll usually just make sure the hygienist just does a lot more work for a little bit of a prophy. Now, in a periodontal practice too, if you have attachment loss, what I see a lot is, I'm glad that they diagnose the perio. Clinical attachment loss, a little trick, is 1 to 3 is mild, 4 to 6 is moderate, and 6+ is severe perio, okay? So if you have that, you can basically, if these attachment loss and they're bleeding, you go into SRPs. Now, most doctors will go, you need 4 SRPs. After SRPs are done, they're shot back into perio maintenance. And what you don't see a lot of people on the schedule is the reevals. I don't know why. Most practices don't have reevals. This is the most important. In a periodontal office, for a periodontist, they do this all the time. Because once they're done with SRPs, of 4 typically, if you have a quadrant that has more bleeding, you may need to do some arrestin or another quadrant of therapy. And you may need non-surgical therapy, and once you're going back to reval, if you're healthy, then you're shot back to perio maintenance. Or, why is this important for implants? You have a number 18 that's just not getting better. Surgical therapy. You may need an implant, pull the tooth, maybe it has a furcation involvement. It's just not going to get better under any regards. And that's why in a periodontal practice, periodontists build huge practices. And it's based off therapies and implants these days, and it's an amazing thing. So if you're a general dentist and you're thinking about tapping into implants, or even you just want to improve your practice, look at periodontal. Get informed. It's about attachment loss and bone loss. It's not about, oh, you got 2mm pockets. That's not a dictating factor. Get educated on it and unhandcuff your hygienist. A hygiene program can be so profitable for a practice. But I don't care about the profits. I care about is the right approach to dentistry, honest, ethical treatments. And it's something that if you utilize correctly can have a profound effect on your practice. But if you're getting into implants, you must control your periodontal program. And because these patients may need more implants, but they need to actually have good home care and actually be on a program that they can make these implants successful long term. So hopefully I got my point across. Thanks for visiting with me. I'm Dr. Chaffet at the SI Institute. Click on the link below if you're interested in joining another course, because our implants, our practice, our institute is more than just training on implants. It's very well rounded. Thanks for visiting with me.